It's nothing new. Botox. Maybe you've done it, maybe you've contemplated it, but a recent trend is making it much easier to access. We're talking about Botox parties. A quick search on Facebook pops up several happening soon in and around Sacramento.
Because it affects your look, it affects how your eyes look and your face look.
While people may be targeting those fine lines, medical professionals warn about the fine line between convenience and safety.
We're living in an age where, again, the convenience and the fun, we want to create that type of an environment.
Kimberly Ruby is a consultant at Precision MD, a cosmetic surgery center in Elk Grove. They perform Botox, fillers, and other procedures. Dr. Mahmoud Khattab, a board-certified plastic surgeon, is the only one who does Botox injections at Precision MD.
I don't think it's a good idea to go any of those parties for multiple reasons. I have seen patients that were undertreated or overtreated or treated in the wrong area or wrong injection, meaning they might have droopy eyes, they might have really big bruise because they injected in a big vein.
Botox parties can be held inside someone's home, at a salon, or at a business.
When you're in such a social environment, you are risking that level of professionalism. Even with a professional, that could get a little blurry and end up with a less than qualified result.
Dr. Khattab says it's best to have a medical professional administer the Botox in a medical environment because it is a procedure that can have some serious risks.
Now, if you go to other places, salons or things like that, I don't know how the equipments, I don't know how the safety of the injection, they're clean, they're not clean, risk of infection, risk of contamination. You know, we then run into sometimes dangerous things like hepatitis C or HIV if we by mistake share needles or book the wrong person.
If you have a bad experience, you can file a complaint with the Medical Board of California, but they do not regulate Botox parties or track complaints from them specifically. Carlos Villatoro says all consumers getting Botox should know only a few people with the right type of license can administer Botox.
State law doesn't prohibit where Botox procedures can take place as long as they are administered by a physician who is licensed by the Medical Board of California, a registered nurse, or a physician assistant under the supervision of a licensed physician.
No one unlicensed can administer Botox, including medical assistants.
A consumer should make sure that their physician is licensed in California.
We asked the board to pull some data for us to see if there are trends with Botox complaints.
Within the past 5 fiscal years, the board has seen an increase in the number of complaints related to Botox. Now, this can be anything from not providing Botox to having a bad reaction to Botox.
In 2014-2015, the board received 34 complaints, every year increasing to last year at 75 complaints. And so far this fiscal year, the most recent data shows 33 complaints statewide.
The concern of the board is that physicians are following the standard of care when administering these Botox procedures to their patients.
If you're going to a social party, there should be some documentation of what you're doing, how you're doing it, and when.
Botox treatment, I would say, is a combination of a few things, a combination of science, art, and experience. And in my opinion, doctors are more qualified to do these injections.